The VIP programme is a volunteering partnership programme between the Hospice, care homes, the acute hospital and Age UK Plymouth. We know that demand is going up for care. What I would like to see is volunteers use more in public services and in care homes, because I think there's a real opportunity there just to help personalise care, make people feel that they're valued. One of the things that I was really keen on is giving young people, those who are under 18, a chance to volunteer in care settings that they wouldn't normally have the opportunity to volunteer in.
We knew that young people were wanting to volunteer in this sector and they just were not having that opportunity at all. So actually the young people felt very frustrated by that. You know, the young people were saying, we'd really like to do this, and then the employer's saying, well, you don't have any experience. So, you know, how do we expect our young people to be able to work in health and social care and develop those kinds of careers if we don't give them the opportunity? You know, there were lots of myths, if you like, around young people working in volunteering, what they could and couldn't do. So we've had to do lots of myth busting, lots of very robust risk assessment, but we have succeeded in being able to have volunteers who are now what we term patient facing in the hospice, which has worked extremely well.
Volunteers can do the little things that make a big difference to patients, and the things like painting nails, walking in the garden, just sitting and listening, reading, things that nurses would love to do, but they haven't got the time to do it. And one of the things that we've learned as well from the project is that we want a mixture of volunteers. We want more mature volunteers to actually support the young ones as well.
It has been a way of bringing young people and older people together in quite a challenging environment, but so that everybody benefits from it, really. Young people are coming to us just needing that experience to put on their CV, needing references, but then when they have been with us for a while, it moves beyond that for them. They stick with it because they get a lot more than they give. It exceeds their expectations. They are a crucial member of the team.
Once they come into the home, we kind of look at what they want to achieve from the placement. For some people it's just they've got a bit of spare time to give and they want to sort of give back in the community, and others are actually looking at it as a kind of stepping stone to a future career, maybe in nursing or in the care role.
As a mentor, I guide the VIPs through volunteering here and help them integrate into the home and talk to all the residents. It's a great benefit, not just for the home, but for me as an activities coordinator. When the volunteers are here, they can just spend a lot of time one-to-one to residents. It's just really helpful. The residents love them.
Initially, they're quite nervous, sometimes quite anxious about being around people with dementia in case they say the wrong thing or, you know, they might offend them. And then by the end of it, they're actually a lot more confident and they get to know people and, oh, how are you today, Phyllis? You know, and they really, really enjoy coming in, so you can really see a difference there. And I think that really improves somebody's day, especially somebody with dementia.
It's nice because before I came to here, I studied health and social care level 1 and 2, so I had knowledge a little about it, but I didn't have experience. It's not like benefits just for the people who they are volunteering for, but for themselves also.
We have actually been surprised at how responsive our patients are to younger people. We thought they might prefer an older person, but actually that assumption didn't prove true. And people are actually saying to us that their concerns have not come true. It's, they are as professional as any other volunteer would be, because the training is so good as well.
You know, in many ways it's about shaping the next generation of carers. So the next step is to roll out the Care and Compass project, which is essentially about volunteers obtaining QCF qualifications, some of them in end-of-life care, and then other more experienced volunteers who will be trained as peer mentors.
What I would like to see is people giving this sort of volunteering project a go, really, and actually helping youth to actually feel part of the caring society. There is going to be a national toolkit available. It'll all be electronic with all our processes, HR processes, risk assessments, our training materials, and we're more than willing to help other people set up similar projects in their areas.
Human interaction. You can't measure how important that is for both our volunteers and for our patients. You can't put into words how valuable it is to everybody involved, really.